Top Med Talk.
Hello, I'm Desiree Chappell, and this is Top Med Talk. We're coming to you live from the American Association of Nurse Anesthetists 2019 Annual Congress in Chicago, Illinois. Now, AANA 2019 is a gathering of over 3,000 certified registered nurse anesthetists, or CRNAs, for the largest networking and educational event in nurse anesthesia. This year, AANA has partnered with Top Med Talk to bring the meeting to our listeners. With over the course of 3 days, we've been sitting down with presenters, AANA leaderships, delegates, inventors, representatives within our community to discuss hot topics in the CRNA community and anesthesia practice. Now, I'm joined, as usual, by my co-host, Monty Mythen, our editor-in-chief for Top Med Talk. Hello, Monty.
Hey, Desiree. Good to be here.
It is good to be here.
It's been a great meeting.
It has
really
been a
good
great
meeting. We've recorded, I think, some really excellent content.
We have. It's a little bit different than what we normally do.
Yeah.
Somewhat, maybe, but I love it. It's good conversations. So if you haven't checked it out, make sure to check out on Top Med Talk, the AANA 2019 conference. You can hear some of the highlights from that. So that'll be good. So we have had the opportunity to sit down with some key opinion leaders, ex-presidents, people within our diversity and inclusion committee, all different walks of life here in our CRNA community. And one of the highlights I think has been really interesting is talking to the inventors and innovators within our organization. We've had the opportunity to sit down with two here today, Dan Simonson, who is a CRNA, as well as Jack Hitchens. Gentlemen, thank you so much for joining us.
Well, thank you.
Yeah. Well, let's just dive right in because I'm really excited to talk to you about what you guys have been innovating and working with, invented. Jack, you're a CRNA. Can you give us a little bit about your background?
Sure. I've been a CRNA. I'm starting my 42nd year. I'm from Delaware originally. I did my nursing education in Philadelphia, Pennsylvania, and my anesthesia training in Lancaster, Pennsylvania. And
Lancaster.
Right. That's right, where people go to see the Amish.
Yeah, the Amish.
Right. No, it was a great opportunity, good learning experience. And then I moved to Harford County, Maryland, where I've been ever since 1980. And I'm married, have 2 children, a grandson. And I worked in a small community hospital for 7 years. Mm-hmm. And then I went out into private practice working primarily in ophthalmology. And I've been doing that, and I now have my own group, and I have 2 other CRNAs that work with me, and we cover 4 different surgery centers. So that's
wow.
And my professional activity, I've been involved with the AANA since 1988.
You got a lot of ribbons there.
Yes. Someone called that peacock syndrome one time. I thought that was interesting.
That ain't the longest I've seen.
No.
Yeah, right, no. Actually, I have a couple more, but you got to stop sometime. Right. So I've been involved both on the state and the national level, and the highlight is I was served on the foundation board and was chair 4 years ago of the foundation. So I love my profession. I love working with students, and doing this open source anesthesia electronic medical record has been a great experience.
Yeah, well, let's get into that in just a second.
Sure.
But Dan, give us a little bit about your history.
Okay, well, I've been a CRNA almost as long as Jack, and I graduated from the Army program in anesthesia in 1981, and moved to Spokane, Washington, worked there for a few years, and then got an opportunity to open a ambulatory surgery center, an ophthalmic surgery center, when they were just opening in 1984, and I became the managing partner and chief CRNA of the Spokane Eye Surgery Center, and did that for 28 years. By the time I retired, we had 5 ORs. We're doing 9,000 cases a year, and it was a really big job. I call that my big job. And I retired in 2014. And I wanted to keep my hand in. I'm very proud of being a nurse anesthetist, and I enjoy taking care of patients, and so I didn't want to give it up. And so I started doing things like oral surgery, podiatry, small places like that. And now I'm just living the dream. I work a few days a month and then travel, and spend a lot of my free time is spent coding on our project here. I have my lovely wife, Nettie, and 3 children who are all grown now, and 4 grandchildren, and really enjoying myself.
Oh, that's fantastic. Well, tell us about your project.
Well, wonderful. So when I retired, Jack and I both were, friends for many years because we both did ophthalmic anesthesia, and we both ran ophthalmic surgery centers. And so one of the tools that we used and learned to use was FileMaker. And FileMaker is a wholly owned subsidiary of Apple, and it's a database development program. And we would use it to do all of our ad hoc databases and things like that. When I retired from my big job, I immediately, upon going to like an oral surgeon's office, realized that there was, number one, I can't read my own writing. So, and the records that we were given was a 1991 AANA promulgated PDF of a record that had little tiny fields to write in and so on. And I was cramping my hand, and I was talking to Jack about it. And I said, Jack, we could do this in FileMaker. And he agreed, and both of us are very data-centric folks. I was data-centric because in 2007, I spent 7 years creating a project looking at comparing hospitals that used only anesthesiologists with hospitals that used only CRNAs in terms of morbidity and mortality among C-sections. And I published that in 2007 in Nursing Research. To great acclaim. It was really one of the high points of my career, and it was all about data, and it was data I had obtained from the comprehensive hospital admission records, and so I had a long experience working with that. And Jack, at the same time, he was on the foundation, and they were dealing with trying to get data sets for various projects they had, and it was very expensive. And what we both realized, that for CRNAs working in situations like I was, small, solo, nobody was getting their data. Nobody, because they weren't bothering with MIPS. They weren't bothering with, should I span that acronym, Medicare Incentive Payment System data. They weren't reporting that. Many of their cases were cash cases, so there was no need to do that, and they were not recording their data. And so essentially, in our modern age, they're invisible. And it's our concern, both of us, because these small solo practices have been the ones that traditionally have made our way through legislators. When, the hospitals can say, what do you mean? We have all these anesthesiologists. What do we need independently practicing CRNAs for? But when you're able to come up with data saying, well, they're doing so many jaw cases, they're doing so many podiatric bunions and all the things that make our healthcare system work, and we can provide solid data for that, we have a tremendous tool. So that's what the germ of the idea for Awesomer, which is our open source anesthesia electronic medical record. It was to be a free or low cost way for CRNAs to digitally record their data. The vision is that that'll protect our practice into the future.
Interesting. So, Jack?
And also, I agree with everything Dan said. Another thing is that I had used FileMaker. I'd written when you go into a surgery center, they give you a bunch of Xerox papers with, the mailing labels on it with the patient identification. And you end up writing the allergies 3 times on a piece of paper. There's so much redundancy. And with FileMaker, I was able to write a program for our surgery center where the data was entered once, and that field could be populated wherever necessary in whatever form, what have you. And then I carried it over, and I wrote my own billing program for my business. And then also I just incorporated that, and I wrote the billing program for the ophthalmic surgery centers I was affiliated with. So right now it's in about 5 ophthalmic centers using this program. It's worked out very well. Another nice thing about the data collection, being on the foundation, is that data is destiny. If we don't have this data, we're going to be really behind the 8 ball. Another neat thing, I've done some mission work in South America, and you get down there and they give you this Xerox to the 10th power form. You can hardly, and also too is that I have so many friends that do mission work, and there's no repository of the number of cases we're doing, whereas what a great PR piece. But people do mission work out of love and, to help their fellow man. But still, it's okay, I feel, is to be recognized, to let the world know, hey, these people just aren't going to work, making a ton of money and stuff like that. They're giving of their time. They're going, to third world countries, sometimes putting their health and their lives, I went on one brigade and we had machine gun guards. It was, but just the pleasure of going down there, but getting that data out there and let people know what CRNAs are doing.
Mm-hmm. So, Jack, if I want to go and have a look at the AEMR, the Anesthetic Electronic Medical Record, I assume you've got a website I can go into and look at a demo? Or?
It's www.osaemr.com. And there's some an enrollment form to receive information. We're also and there's manuals, very, very good manual, almost a 300-page manual, both in PDF and Word document. And Dan has also done some videos to help people get the stuff downloaded. And also, too, we're very happy that our app is now on the App Store.
Great.
So I can use it on a number of different devices. Just Apple, just on the iPad right now. You could not use it. We don't have if we get the funding and stuff, we may look into the Android market. But right now, it's just the iPad. And the neat thing about the iPad is, iPads have been out for a while, is that if someone does not need to purchase a brand new iPad, there's a lot of nice reconditioned ones at a reasonable price. And
so I'm up and running, and I start to record my. Well, how could I get myself into trouble from recording identifiable patient data?
Well, really nothing, because remember, this is an Apple product. If you remember the San Bernardino shooting, the FBI couldn't open the iPad, and the iPad. To get into Awesomer, number one, you have to get into through the security of the iPad.
Yep.
And then we have a sign-in, password protected.
So double password protected.
Double password protected, yes.
So HIPAA compliant?
It's HIPAA compliant, yes.
Excellent. They say open source. Now, open source means different things to different people.
I'll let Dan answer that one.
Well, when we started, the dream I had when I started talking to Jack about this was that it would be open source in the sense that anyone would be able to contribute code. We weren't looking to make money, which is interesting. If I can go off into that side thing, everybody approaches us now and said, boy, you guys are going to make a lot of money at this. Well, the first thing I want to say is, no, there's not a lot of money for the market that we're targeting. There's not a lot of money out there. And secondly, for us...
Let's clarify on that, Dan, because either big shops have either got their electronic health record embedded and they've already invested massively in it, so they're not going to be going to your technology. You're filling in all the gaps.
Yes, that's correct.
And the gaps are there because they didn't have the resource to have the EHR.
Right. Yeah. If you were doing enough cases to justify an EHR, that's what you should do. Yeah. We were approached just yesterday or this morning by a CRNA, and I said, where do you practice? And she said, oh, well, we have 20 docs and 20 CRNAs. And I said, well, this isn't for you.
Yeah.
But on the other hand, if you're doing plastic surgery practice where you work a few days a week for the entire year, you're not going to pay the tens of thousands of dollars that it costs to institute that. So that was the reason we wanted to do that. And the reason also is it's a contribution to our profession, and people don't think of it that way. Like I said, when I wrote my article in 2007, that took 7 years of work. Nobody ever asked me, oh, Dan, you're going to make a lot of money around that. No, it was to me the pleasure and the pride of doing something for my association and my profession. So the same thing. So we thought we'd set up a framework that was open source and anyone could download our FileMaker files, modify them, and add to them. But that really hasn't worked out well. So we keep the open source, and we do want to make this a resource, but it doesn't work in the same way like Linux and these things that are true open source where they have thousands of programmers contributing their time. It doesn't work that way, but we kept it because we liked our acronym is OSAEMR, and we call it Awesomer.
Awesomer, yeah.
Yes. And when we come out with version 2, it's going to be known as Even Awesomer.
I love it. That's awesome.
Yeah, and I always say, no, that's Awesomer.
Awesomer.
And my wife Nettie says, you say that one more time.
The most awesomest. That's what you do. That's cool. So it's open access, though, completely free. So if someone wants to find this, they can go online and look it up there and look at the app. But it's for the CRNA community only? Well,
the CRNA community, but one thing that's come out of this, you always have these unintended consequences. We first exhibited at a school faculty meeting 4 years ago, and a professor came to look at it, and he says, I need this in my sim lab. Because it's free, a lot of educational institutions don't have the EMRs in their sim lab. So this is a mechanism the students can do a case, and electronically document their care. And then it's a pretty robust program in that we now have one university that we have almost 50 students using it just for their pre-anesthetic evaluation and care plans. Dan and I worked on developing the care plan. And so in my day, we filled out our care plans in paper, and we stood in line to get our care plan approved.
Yep.
And now with the millennials, they can fill out this evaluation and then email their care plan with identifiable patient data, to their preceptor. And it's just been a great tool, but also for the students, it's a great learning tool to do your pre-op evaluation, get your care plan, but it's also something they can put in their anesthesia bag when they graduate. So if they have that opportunity to go out or do a mission trip or whatever, it's there, and they can present. It's really some of the CRNAs that have used this program, say they're plastic surgeons or they're your GI docs, love this professional-looking document because it's a reflection on their practice as well, instead of just a handwritten document.
Sure. Yeah, Dan.
And what I wanted to add was originally we developed only for CRNAs. That was the only kind of provider you could enter into it. But we kept getting interest from anesthesiologists, especially in Medellin, Colombia, and from the Netherlands, and they would ask, and they would use it, and I'm sure they were using it, and it still said CRNA. They didn't care. Yeah. But we realized one group of CRNAs came to us, and they had one anesthesiologist, and I believe they were in Michigan, and they said, we have to have an anesthesiologist if we're going to practice and so on, to, quote, supervise. And so begrudgingly, okay. So we added that, but we also added now you can, the providers that can use it are MDs, DOs, CRNAs, DVMs. Veterinarians have approached us and numerous companies. We now have it downloaded into about 20 countries, including Russia, Kyrgyzstan, Indonesia, India, because it's freely available. And what I want to emphasize on the podcast here is one of the easiest ways to get an introduction to Awesomer is just download it from the Apple App Store. Yeah, there's no way to get in trouble there because you could just play with it, create a bogus patient, create those things and see how it works. And then once you're enamored with it and you feel like it really has a use for your clinical arena, then you can go to our more robust, what we call our FileMaker Go version, which is more robust and more easily updated and so on.
Now, if you did want to, in an environment where the EHR isn't coming your way, if you did want to move up to it being your multi-user platform, you can do that, but I'm assuming that does require some resource to make that happen.
Yeah. So let's say that you use it, and this is what we found. Somebody was using this, and they said, this is great, but we have a 5 CRNA or 15 CRNA shop, or sometimes a mixture of CRNAs and anesthesiologists. And so the great thing about the development platform we used, FileMaker, is that we can do that. You can have a FileMaker server that's in the cloud. And then instead of having 5 different iPads with 5 different copies of Awesomer, you have one copy that's up in the cloud, and it's brought down to each of the iPads. And it adds an extra level of data security. And also, you can have a central place where your office staff, back office staff, can pull reports, can do the billing, and so on. So it's very efficient in that way. And it wasn't in our original plan, but it was so easy to do and add that we now have that. And that's the one way that we do get some money out of you. So if you're going to use the cloud version, then we ask for a licensing fee in addition to the cost of the cloud.
So if I'm out there in the United Kingdom where the electronic health record has made minimal penetration, for example, and I'm running an anesthetic department and I'm tired of badly written paper reports, I hypothetically could, or actually it sounds like, I could buy an iPad and bolt it down for each anesthesia room, and I could use your cloud version of it, and I'm up and running with is that right?
Yeah.
Yes.
Beautiful.
And the nice thing about it is that with the FileMaker platform, the relational database component, you can do all of inquiries and stuff about, geographic area where your patients come from, or even your morbidities, how many, BMIs are above 45 and stuff, they get a good reflection on the patients you're caring for.
And am I recording in the operating room anesthetic record as well? Am I recording the hemodynamic variables and the drugs?
You have to manually enter those in there.
But I can.
Yes,
absolutely. It's my full record. It's
your full record.
It's what used to be my chart.
Yes, your electronic chart. Yes, you're going to all the vital signs, your gases, your remarks. We have presets in the program, so if you do pretty much the same thing, you can enter the preset. I do a lot of ophthalmology, and I'll do maybe 15, 20 cataracts, and I use my presets based on my different doctors who have their little idiosyncrasies, and the preset entries come based on the times, anesthesia start time, surgery start time, surgery ends, anesthesia finish. So as you put those times in, the program populates the remarks, the medications, like at the end of the case, the inhalational agent goes off, and it preprints, it populates it onto the record, saves a ton of time, and then you just have to go back and maybe adjust it to that specific patient, and it's very clean and very easy. So
if any of the big players in this space tapped you on the shoulder and said, hang on a second, you're showing people that you can do this cheaply, effectively, efficiently, that's your kind of like, we do this expensively and chunkily. Well, this is hurting us.
Yes, that's a good point. I went around, I left Jack alone at the booth, which is dangerous, but I left him and then went around, and there are 3 other anesthesia EMR vendors here and I went up to each one and chatted them up, and I told them immediately what I was doing, and they were very interested. And Awesomer is much like Linux in that in the early days of Linux, it was there and it was free and anybody could use it, but it took a tremendous amount of support and knowledge to, you just didn't buy it and plunk it in a machine. And so they're developed aftermarkets like Red Hat Linux and Yellow Dog Linux, and these were companies that worked around it and implemented it for you. And Awesomer is the same. If you were to take, Awesomer could theoretically run 100 CRNA anesthesiologist group, but it would take a tremendous amount of support, and that's what we don't provide. It's just Jack and I and our board of directors, and we're out here and we give you all kinds of, I'll talk to you on the phone as long as you want, but the kind of support you would need for that kind of thing, you'd have to provide yourself. Yeah. So, those folks out here who are providing the anesthesia EMRs, they're charging you for this. That's what you're paying for. The software, obviously, somebody like Jack and I can do the software, but what we can't do is all the sales, the organizational thing. Right. Yeah. So it's when you feel like there's such a disparate amount of money involved that it's worth it to do it yourself and get it on. For the single CRNA, it's fairly simple to do. Yeah. But multiple users is more complicated.
Well, gentlemen, thank you for sitting down with us and chatting about this. Just the innovation that you've taken upon yourselves, and it's kind of a second career almost, or the next step, I guess. And it's really interesting. So
I just would like to, the AANA has been very supportive. Randy Moore, the executive director, has been very supportive to us and helping us come to meetings and stuff like that, and we really appreciate the support they've given us.
Yeah. Excellent. So we'll get in the show notes. Just again, it's OSAEMR.
That's correct.
Yeah, you may choose to pronounce it awesomer.
Awesome.
Yes.
And coming down the pipeline is even awesomer. Okay? And hopefully we'll sit down and interview about even awesomer when it's out there and even awesomer.
That'd be great.
Well, and what I want to, for every CRNA listening to us, remember, data is destiny and it's your duty. If you're working on paper and you're not submitting your data, you are not providing a legacy for those to come. You need to get your data down.
And Dan, could we switch that a little bit? Say every anesthesia provider, because there's a big old world out there.
Yes, there is.
That's right. There's a whole range of people giving anesthetics.
That's right.
And it all needs recording.
Yeah. And they don't have the excuse that it's too expensive anymore.
There you go. That's a very good point. So, well, thank you for everything that you do, and appreciate it. And we'll take a look at it ourselves. So, good luck in your endeavors, thank you for listening to Top Med Talk. Be sure to check us out on social media: Facebook, LinkedIn. We're going to do some Instagram. That's the next step. So we're going to try and get in some new technology.
And come and sit down and chat with us.
Where's
the next big show we're going to be at?
The next big show.
There's Dingle.
There's Dingle for EdPalm.
West Coast of Ireland.
The Irish Society of Anesthesiology.
And then there's the ASA.
ASA, American Society of Anesthesiology.
So anyone come and sit down with us, have a chat, we talk to almost anyone.
All right. Well, thanks for listening. We'll catch you next time. Cheers.
Great.
Thank you.
Nate Majerison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out topmedtalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. topmedtalk.com and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.